Okay, Mr. Rogers, I just wanted to go over a few things with you. Starting off, I know we did administer morphine for your pain, and although that does help decrease, some of that sharp pain that you are feeling in your heel from the pressure ulcer. However, there are other ways to kind of help reduce that pain that you are feeling. So what I wanted to go over with you today was a thing called guided imagery. It helps a lot it's a non-pharmacological way to kind of distract your mind and to ease your mind when you are feeling some discomfort or pain. So what I want you to do is close your eyes and picture some place that makes you really happy, and just picture yourself there, not in pain, and just it guides your mind away from that discomfort that you are feeling. So can you tell me what's a favorite place that you really like to go to? Hawaii? Okay, so what I want you to do is close your eyes and picture yourself on a beach in Hawaii, and it just distracts your mind from that pain that you are feeling. So that is one of the ways that I like to teach my patients about decreasing that level of pain that you might be feeling, and just get your mind off of it. Secondly, I did want to go over some of the medications that you are on. Now, in your chart, we do have, and you have stated that you don't have any other previous medical histories, but you are on a blood pressure medication. It's called lisinopril. So, is there any reason that you are taking that? Do you have a history of high blood pressure? You do? Okay, so we will have to get your chart updated. So the thing about lisinopril is it is a blood pressure medication that does help decrease the amount of pressure that your heart is working to pump your blood throughout the rest of your body. So before you do take your lisinopril, it's really important to take your blood pressure before you do take that medication. So can you tell me what you need to do before you take your lisinopril? Take your blood pressure. Okay. And then another thing that I do like to talk about is your blood thinning medication. So while you're in the hospital, we do like to give a medication called Lovenox. So since you are laying in bed, and we do want to prevent blood clots. So the more that you stay inactive, the more likely that your blood is gonna pool and it's gonna clot up. And so the enoxaparin, the Lovenox that we do get, it prevents that, and it prevents venous stasis. So one of the other things that I did want to talk to you about is using the incentive spirometer. So we do use the incentive spirometer in the hospital while you are laying here. And it just helps prevent atelectasis. So atelectasis is kind of the destruction of the little alveoli in your lungs from, being inactive and not getting the appropriate amount of oxygenation in your lungs. So we want to strengthen them and keep them open in your lungs. So the incentive spirometer is really important to do that. Can you tell me what you need to use? It's right here on your bed stand. Can you tell me what you need to use in order to prevent atelectasis? The incentive spirometer. Good. Okay, so another thing that I did want to talk to you about is increasing your fiber intake. Now this is very, very important because you are getting pain medication, morphine. So morphine has, one of the side effects that happens when you do take morphine is it causes constipation. So to prevent that constipation, we really want to increase our fiber, so it kind of helps you soften your stools. That's really, really important. Also, since you do have a wound on your heel, another thing that we wanted to do about our diet is increase our protein. Protein actually helps the healing process, and it's really important to get an adequate amount of protein in your diet to kind of help increase and help that healing process of your wound. So what are the two things in our diet that we need to change? We want to increase our protein, and we want to increase our fiber. Good. Okay, so it's also really, really important to increase our fluid intake. This is going to help regulate, your kidneys, so we don't have to experience any sort of electrolyte imbalance on top of everything else. It's also going to, help with the dryness of the cough that you are experiencing. So you are on medication. It's an ACE inhibitor. One of the side effects of the ACE inhibitor, it does cause a dry cough, and the frothy spit that you kind of are coughing up, it could just be spit from your dry cough. So sometimes to help alleviate that, we just want to either suck on some hard candies, or we want to increase our fluid intake. It's going to help regulate your urine output as well. So what do we need to increase more of to kind of help out with the cough and the frothy spit that you are experiencing? Increase fluid intake. Good. Also, while we are in the hospital and laying down in the bed, it's really, really important to do range of motion exercises. So I know the wound on your foot causes a little bit of a disadvantage for walking, getting around. So another thing that we could do to kind of add to that is do range of motion activities while you're laying in the bed. So we can, flex your foot and just kind of move around to get those muscles working. And that also helps prevent venous stasis too. Get your muscles working, and it also get your blood pumping too, so that blood, like I said before, is not pulling in your legs. Can you name another thing that we could do besides walking around to kind of get your muscles moving and your blood pumping? Range of motion exercises in the bed, yes. And that could also just include repositioning and turning yourself, every couple hours, because one of the side effects, it's pretty common for patients that are laying in the bed for long periods of time, is it can cause skin breakdown. So we want to prevent that skin breakdown by moving and repositioning every couple hours. I say every 2 hours, because there's pressure points on your body that your skin is pushing up against them. So it's really easy to just have that skin breakdown, because the more that pressure is holding on that area of your skin, the less blood flow and oxygen are getting to that point. So can you tell me what we need to do every couple of hours to prevent skin breakdown? Good. Move and reposition. Okay, so for your skin also, I wanted to kind of teach about the dressing change that we did perform. So we want to keep that wound clean and dry, and we want to change that dressing every so often. It's really, really important to keep that dressing clean. So we want to prevent infection that way. So the dressing that we did is called a wet to dry dressing. So since your wound is a stage 2 ulcer, we need to help debride some of that dying tissue and the gunk that's in there right now. So what the wet to dry dressing does is when I placed the wet gauze, do you remember that, in your wound, that's going to help when it dries out in there, it's going to help debride some of that. So before your next dressing change, it's really important that we pre-medicate you. So whoever does your dressing change next, you want to advocate for yourself and say, hey, I need my pain medication before we do this, because it can sometimes be a little painful, but it does help prevent infection. So can you tell me what is one of the things that you're going to do to advocate for yourself before your wound dressing change? Ask for your pain medication. Yes, it will just help keep you more comfortable during the procedure. Okay, so the last thing that I wanted to talk to you about, it's really, really, really important. So your diabetes has been a little bit uncontrolled for the past couple of months. Your A1C, which is a test that we like to do that kind of shows how you've been managing your blood sugar over the past 3 months, it was elevated. So we need to do our best to try to keep that down. So what I wanted to talk to you about was first your diet and then insulin administration. So your diet is going to be super, super important in maintaining your blood glucose. We need to have a strict carbohydrate diet. That's going to include simple carbs, so sweet potatoes, whole grain breads, things like that. You want to just make sure that when you are shopping, or if your caregiver is shopping for you, you want to make sure that you have a list that you can give them and say, hey, this is really, really important. We need to stick on a strict diet, because the more that we keep eating all of these sugars and fats, it's gonna cause, more issues that it's gonna be harder to treat. So the second thing that I did want to discuss with you is insulin administration. Can you tell me where you normally administer your insulin? You said your arm? Okay, so recently studies have shown that we are moving the insulin injection site into our abdomen. It's going to be better absorbed there. So what you want to do before you administer your insulin is you want to clean the site with soap and water. So you're giving your insulin at home. It's really, really important to clean that site. It prevents infection. Just with soap and water before you administer. And then you want to administer in your abdomen, but you want to rotate sites in your abdominal area. So next time you're at home and you need to administer your insulin, what are the 2 things that are really important? You want to clean the area to prevent infection, yes, and you also are going to start administering the insulin in your abdomen, yes. Okay, so another really important thing to monitor your blood glucose is glucose testing. So it's really important to keep on top of what your blood sugar is throughout the day. So before you administer your insulin, before you eat, everything like that, you want